mai kira.
Yawa doctor.
Gombe State is one of the 6 states that make up the northeastern part of Nigeria. Created in 1996, Gombe State has a population of about 3 million people. The female population is about 1.3 million. The majority of the people are farmers. The topography is overwhelmingly made up of plain lands in the north and hills in the larger southern part of the state. The northeastern part of Nigeria, where Gombe State is situated, has some of the worst health and development indices compared to other parts of the country. The fertility rate in Gombe State is high at 7.1 children per woman of reproductive age. Based on the 2008 National Demographic and Health Survey, only 44% of women in Gombe State attend at least one antenatal care visit, compared to 57% nationally. The majority of the women give birth at home, having received little or no antenatal care from a trained health provider.
Last rainy season, 4 women were in labor. They were river locked. He couldn't take them to anywhere. People came to him looking for answers. What are we going to do? The women are going to die. So will the babies. He just bursted into tears. He was crying helplessly. He is the village head. They thought he can bring out magic from where? Such places. We need a lot of birth attendants to be trained there because we knew when rainy season comes, there's no way out. If there's nobody to take care of them, they will die.
The NDHS survey in 2008 shows that the neonatal mortality is 40 to 1,000, and the maternal mortality is 545 to 100,000. The figure then is showing only 17.2% of deliveries at our own health facilities. That means to show you that out of 100, only 17 women goes to health facilities to deliver.
This trend is a major reason for the maternal and neonatal health intervention implemented by the Society for Family Health in Gombe State, with funding support from the Bill and Melinda Gates Foundation.
The assessment of the project was jointly done by the Society for Family Health and Bill and Melinda Gates Foundation staff. The proposal was jointly written, which means we all tried to banter ideas based on experiences both within Africa and Nigeria, and based on our own personal experiences to come up with this innovative project.
This project started with the learning grant, that is, we are supposed to look for the best approach that will help improve home-based care for pregnant women and their newborn babies, and also improve skilled birth attendants by both rural and urban women, because that particular index is very low in Gombe State, as low as 17% for skilled birth attendants. But we noticed that every problem starts from the home. And if we are able to get cooperation from the community and the home, we believe that things will improve. So we had that grant. It was like 2 years and some months, and we were able to find some approaches which we picked.
The project identified reliance on traditional practices of pregnancy care and care of the newborn, which is made worse by difficult terrains and lack of access to health facilities as some of the challenges affecting the health indices in the state. Therefore, it set out to improve home-based care for pregnant women and newborns, as well as increasing facility delivery through improving health-seeking behavior amongst the men and women of Gombe State. After thorough consultations with all key stakeholders of the state government through the State Ministry of Health, local government officials, traditional rulers, professional bodies and associations, strategies to implement and deliver the interventions were developed. These strategies were rolled out by working through 4 main intervention areas. They include traditional birth attendants or TBAs. TBAs are an important part of the intervention because of their years of experience in delivering the essential service of helping to birth babies in the community. Having this in mind, the project recruited TBAs with the support of traditional rulers, ward development committees, and local government officials. The Federation of Muslim Women's Associations of Nigeria, or FOMWAN. FOMWAN is a national organization with presence in the 36 states of the country. It is made up of Muslim women volunteers who implement home visits, identify pregnant and newly delivered mothers, as well as advise and encourage them to seek skilled care for maternal and newborn matters. They operate in the urban areas of the local governments. And the National Union of Road Transport Workers, NURTW. Here, the NURTW implements an emergency transport scheme where they transport pregnant women, women in labor, and newborns in cases of emergency to the nearest health facility. These intervention areas are the key channels used to reach pregnant and new mothers in the communities. The traditional birth attendants are the closest to the women in the communities. They serve as the most viable means of getting the message of safe motherhood to the grassroots.
Waɗannan matan da suka da aka yi musu bita, matan nan sai suka zo suka picking up ayyukansu a cikin gari. Kamar misali anan mun supporting nasu a aka raba cikin gari nan ciki 3. Mun supporting nasu wannan ke ce da wannan area, wannan ke ce da wannan area, wannan ke ce da wannan area. Suna yawo dare da rana suna dudduba mace wadda take da ciki ko wadda shigowan ciki da wadda cikin ta girma da kuma sabon aifuwa.
When they came, they brought something new. We had these traditional birth attendants. They don't know what they're doing. Sometimes they complicate deliveries. When they came, they introduced a system of using what we have available with us, that is traditional birth attendants. They retrained them. Not only did they train them to be able to make a woman have safe delivery, they brought with them safe delivery kits, which is affordable to our people. So a woman can have safe delivery and clean kits to take care of the baby and also the mother.
These meetings, usually attended by traditional rulers and gatekeepers, stakeholders in health from the government and civil society partners, provide fora for community volunteers, TBAs, Form 1, ETS, and ward focal persons to be presented to the communities for recognition. The TBAs, or Ngwanzoma as they are fondly called, are now popular in Gombe State. They look out for and identify newly pregnant women in their relevant communities where they have been strategically clustered for maximum impact. And Ngwanzoma counsels pregnant women on the most hygienic and best practices for expectant mothers and newborns and makes referrals to the nearest health facility for the client to receive skilled care.
With the coming of Society for Family Health now, if you go into the LGA, you ask anybody, they will tell you that they have TBA. So they have made an impact. They are being recognized into the community. If you happen to meet any health facility that they are undertaking their antenatal on that day, go to the health facility. You will see the TBS, the 4-month volunteers escorting women. They have motivated some women. They brought the women to the health facility to access the services there. So I think among all the partners, Society for Family Health is the only partner that has gone deep down into the grassroots to motivate women to access the health care.
This is Kilang Hill in Kaltungo local government area of Gombe State. At the base of the hill are Fulani settlements with scattered thatched houses. Yelli, a Fulani woman and recognized traditional birth attendant, lives here. The story of Yelli is a fascinating one.
Time inda ban yi wannan ba ai min wannan bita ba. Nakan samu ciki in nayi gwaji lokacin aifuwa sai in aifuwa gida. Bana zuwa asibitin aifu. To, akwai kuma wa'ansu da ba su zuwa gwadin ma gaba ɗaya. Wata za ta iya ba da sawari wa mai gidanta, zan dinga zuwa gwadi. Sai su iyaye sai su ce da kai din gwadi ne na je da na haife ka? Ai ban je gwadi ba har na haife ka har ka girma ka yi mata, za ka nuna mun wai kai ma wani wayo za ka je asibiti. Asibitin me suke bayarwa? To kayan ana cikin dufu. To amma yanzu da aka wayar musu da kai, gaskiya sun ji sun gamsu suna zuwa asibiti ba wani matsala.
With the training received from the Maternal and Neonatal Healthcare Project being implemented by the Society for Family Health, Yali is now an established trained TBA who has influenced her people to attend health facilities for maternal and newborn care.
Duk mata yanda suke da yara ba wanda ta haifu a gida. Kuma ni suke kira. Kuma ko sa biyun dare muka ɗauki mata muka je lanteme za mu samu ma'aikata. Za su karɓe mu hannu bibbiyu ba wani matsala.
In the nomadic settlement she covers, there are about 20 households sparsely situated. Yali makes her rounds daily, visiting newly delivered mothers, identifying new pregnancies, and delivering the message of safe motherhood.
Nima ina cike da murna da yadda suka karɓa wannan aikin nan da aka bani amana. In zo ina faɗakar da mata mahimmancin zuwa asibiti sun yadda suna zuwa.
Dija Adamu is another Fulani woman that has been transformed by the Society for Family Health intervention. She lives far away from the local government headquarters. Dija has 5 children, but it is only the 5th child, Adamu, who was born in a health facility.
Da na ji na guda sai na ce to a kiro min Yalli din ta jo. Sai aka kiro min ita ta jo ta ce to yanzu ba jama. Sai mu je asibiti a gani abun da Allah zai yi. Sai muka je asibiti. Da muka je an haifu yaron nan an yi min allura an bani magani sai muka dawo gida.
Not only was Adamu born in the health facility, he was also exclusively breastfed for 6 months.
Da muka je asibitin, daga asibitin suka ce min to jan iya in bar yaro bana ba da ruwa na sai jan iya. Suka ce min jan iya wata 6 na sai jan iya. Da muka dawo yaron nan bai sha ruwa ba yanzu na fara ba shi ruwa sati 2. Wata 6 ya wuce wannan wata shine na 7. Yanzu ne na fara ba da ruwa yanzu yana da sati 2 da sa ruwa.
This chain of events started when Yali, the TBA in charge of Dija's cluster of communities, came calling. The involvement of Form 1 as volunteers in the Maternal and Neonatal Healthcare Project in Gombe State is indeed a positive one. Like the TBAs, Form 1 members are everywhere, especially in city centers.
Da muka yi wata training muka dawo. Mun zo mun ci gaba da zagawa muna duba mata. Mu kuma da aka ɗauke mu a nan mu 20 ne. Kowace ce da anguwanta inda take aiki. Da anguwanta da sunan anguwanta da muka zo muka bayyana kanmu wa jaurabanmu suka mana murna da abun to sai muka ci gaba da aiki.
They observe, advise, and encourage pregnant women and their families on matters relating to early or late pregnancies, deliveries, and care of the newborn. Most importantly, they make referrals to health facilities.
Muna duba mata da yara ƙanana wanda ba su wuce kwana 28 ba, jirajirai kenan. Daga aifuwansu zuwa kwana 28 ɗin. Muna tare da su tun daga cikin uwa. Muna musu ziyara. Muna faɗakar da su akan mahimmancin zuwa awo a asibiti.
Just like the regular supervision and step-down training provided for facility staff in order to build their capacity, TBAs, Form 1, and ETS volunteers receive refresher trainings called review meetings. During these gatherings, project markers that record low performance are given attention. Synergy between the volunteers is encouraged so that the seamless nature of the intervention remains intact. Data collection and analysis is an integral aspect of the Maternal and Neonatal Healthcare Project, as all decisions implemented are evidence-based. In the case of the TBAs and Form 1 volunteers, 8 to 10 volunteers are attached to a representative for effective supervision and mentoring, as reported by Mama Mail Sule.
Wancan watan da ya wuce ga waɗanda na ziyarce su. Na ziyarci ita Salamatu, na ziyarci ita ran Monday, na ziyarci ita Iras Laban, na ziyarci ta ran Friday, na ziyarci ita Ku Muhammad, na ziyarci ta ran Thursday, na ziyarci ita Adana.
The program officers pay supervisory visits to the representatives for data collection and information on low-performing volunteers that require extra help.
Na ce duk wanda suke karkashinki ba karɓa aihuwa gida ko in sun ziyarci mata su gaya musu batun shirin aihuwa ko su yi ta tanadi kuma.
The National Union of Road Transport Workers, NURTW, provided the much-needed platform for the emergency transport initiated by the Maternal Health Project in Gombe. Volunteer drivers were trained on how to respond and handle health matters when women are in transit from their home to the health facility.
To lokacin idan an kira direba cewa ya zo ya dauki mace ya kai ta asibiti, to direbobi suna da wani hali a tafiyan da za a yi shi misali na 500 naira direba zai ya ce to tunda da daddare ne a bashi almost 10,000, 15,000, 20,000 depends tunda ya riga ya sani wannan family din sun shiga hali mai wahala.
Despite the difficult terrain, the drivers work anytime they are called upon. The TBAs and the Form 1 volunteers all have the contact details of the ETS drivers.
A kullun dare da rana tunda mu mun yarda da cewa an koya mana yadda zamu kula da motoci mu ajiye shi kullum ba mai ko kana lodi ne an kira ka cewa ka je ka dauki mace mai nakuda mukan bar aikin da muke yi a gaggauce mu je mu dauki matan nan mu kai ta asibiti saboda mu ga mun ceci rayuwanta a kullum ko da aiki ko ba aiki ko da rana ko da dare ko a wani lokaci abinda muke yi kenan a wannan karamar hukuma ta Kaltungo.
Pregnant women, women in labor, and newborns are lifted and moved to the nearest health facility for safe delivery and skilled care.
Barka da kira.
Yawa doctor.
Da wa nake magana?
Central to the operations of the various volunteers is the Maternal and Neonatal Health Call Center, built and maintained by the Society for Family Health. The call center is located at the Gombe State Specialist Hospital and operates 24 hours a day, 7 days a week. The call center, a computerized 24-hour service, offers information on pregnancy care, child health, family planning, and malaria-related inquiries. People from Gombe State and beyond call for quick response to emergency situations and referrals to the closest health facility, as well as for advice on home care. Data collected from the field are recorded at the State Office of the Society for Family Health.
This is a field MIS form. What they do at the field level is, for every activity they conduct, they have to strike a balance on the MIS form. These MIS forms will be collected by the respective program officers in the office, and then they will bring it to the M&E unit. What we do at the M&E unit here then is to collate all of it, like you're seeing all this is a patch of one LGA. This is also another in another LGA. So first thing we do, we collect all of this, collate it to an LGA, and then we start looking at the data one after the other. After then, we'll have to tally all the information on the MIS forms, like this. From here, we'll have to enter all the data again to the software, the DHIS software.
A breakdown of information is finally transmitted to the headquarters in Abuja for analysis and decision-making towards project improvement. Some of the data made available shows that between 2011 and 2013, a total of 225,891 women have been reached by TBAs and Form 1 volunteers. Of these, 41,027 emergency deliveries were conducted by TBAs. 41,166 women were referred for antenatal and pregnancy care by TBAs and Form 1 volunteers. 48,217 women in labor were referred to a health facility. 96,271 postnatal visits were conducted by TBAs and Form 1 volunteers, and 3,409 newborns were referred to health facilities. With regards to the ETS intervention, 6,498 women have been lifted by the volunteers, and the call center has received 94,976 productive calls from families and community volunteers. Capacity building has been provided for 130 health workers, and resuscitation kits have been supplied to 117 health facilities within the 10 local government areas of the state by the Maternal and Neonatal Healthcare Project.
Sai mu sake wannan sai mu use 1 2 3 haka, sannan mu wannan in kirjin da tom shi ma su uku haka.
Kangaroo Mother Care is a technical innovation to help supplement care on low birth weight infants and the lack of incubators in homes and rural health facilities for care of low birth weight babies. Health facility staff have since accepted the importance of this innovation to the survival of a newborn.
There is no doubt that the Maternal and Neonatal Healthcare Project in Gombe State has reached women and infants most at risk of maternal and neonatal mortality in communities that are hard to reach with maternal and neonatal care due to distance from health facilities. The project has mobilized health and community workers and has trained and introduced innovations in tandem with best practices and available resources on the ground. As the project is both community and volunteer driven and is able to work with resource-limited communities, it is the hope of the implementers that the path of sustainability has been paved.
And if you build a good community structure, sustainability becomes a lot easier. So the community was involved, government sector in terms of the local government and the state government were involved. And how were they involved? We involved them in getting us traditional birth attendants because these women are closer to them and are well respected in the community.
You don't need to build an entire new structure to achieve what you want to achieve. We used what I would call the available local materials in implementing the Gombe project. We used the Form 1, we used the traditional birth attendant, we used the clinics around. We didn't need to start buying all kinds of equipment to get the clinics working. Many of them were already working.
Zamfara and other states in northern Nigeria have come to visit the program to see how lessons learned and best practices can be adapted and scaled up in their states. There is no doubt that an impact on the lives of women is an impact on the whole family. Gombe State and the people of northeast Nigeria are truly grateful for the impact that the intervention has made on the lives of women and children in the state.